Today we're going to review how to fill out the EyeKnowOphtho ophthalmic examination form. In front of you is an iPad mini with a wireless keyboard. The app that I use to house the form and to fill it out is an Adobe Acrobat app. It is a free download with some upgrades that you can purchase, but I find I can get through with simply the free app. The forms in themselves are fillable, so essentially with the appropriate app you can use a stylus to tap on the field that you would like to fill out, and you can either use the keyboard that comes up on the screen or you can type the pet's name in with the keyboard. Similarly, your history can be filled in here and your treatment regimen at presentation here. Most of the questions that I receive are about this portion of the examination form, so the actual drawings or schematic portion. These two images represent the adnexa, so the third eyelid, the eyelids, the conjunctiva or sclera, and then you could draw the iris here in this circle as well. The cornea is represented here and here, and this is meant to represent a front-on view or a cross-section of the cornea. So, for example, if this patient had a corneal lesion, say a deep ulcer perhaps in the center, you can draw it on there. If you're unhappy with how it looks, you can reverse that image by removing it with the undo button. So for example's purposes, we're going to draw a circle in the center of the cornea and represent that as a deep ulcer right there. So this tells me that the ulcer is in the center and that you can actually see a divot. You probably won't be able to tell depth, exactly how deep this is, unless you have a slit lamp, or obviously if it is perforated. If it's perforated, it would be a full thickness defect that involves all layers and enters into the anterior chamber. This cross-section is a cross-section of the eye as a whole, so the cornea on the front, the iris here, the ciliary processes, the lens, the vitreal cavity, any retinal detachments noted could be drawn in here. This schematic is to represent the lens, so similar to the cornea, a front-on view and a side view, anterior, posterior aspects of the lens. Again, without a slit lamp, exact localization of lenticular opacities can be difficult. However, we can talk another time in a blog post about how to determine depth of lenticular lesions, because that is possible to get an approximate location based on a few tips and techniques. This image here is for the fundus, meaning it is for drawing the optic nerve, depending on the species that we're working with, the vessels. So in a horse, you would simply have, and pardon the drawing, I'm kind of drawing off to the side, the tapetum dorsally, and the optic nerve in the non-tapetal fundus. If we're talking about a dog, you typically would have an optic nerve in the center, an artery vein combination dorsally, and two ventrally. And the tapetal fundus would be here, and depending on whether it's an albinotic or a subalbinotic dog, sometimes we don't have a tapetum in the dog. A cat would look similar. On the side here is an area for noting whether there's any blepharospasm. This I would give a value of either 0 to 3, 0 being none, 3 being severe. The same with the hyperemia. I would qualify that as none to severe. So mild being 1, moderate being 2, severe being 3. This is a Schirmer tear test value in millimeters per minute. In a dog, normal is going to be between 15 to 30, pardon me. Intraocular pressures, again, would go in here in millimeters of mercury, and fluorescein would be shown as either a positive or a negative value. Palpebral reflexes are either present or not, so positive or negative. Similarly, the menace can be positive or negative. However, you can have a decreased menace, and I would typically represent that by a plus minus like that. The dazzle is the act of closing the eye in response to light, and that would be represented again as a positive or a negative. Your PLR direct is whether the pupil constricts in response to light, and again, you would write a positive or a negative there. That's the pupil you're looking at. The indirect is whether when I shine the light into the right eye, does the left eye constrict? Or when I shine the light into the left eye, does the right eye constrict? So essentially, you're looking at whether the wiring from the eye you're looking at is going back to the brain and coming back out to the fellow pupil. And that would be represented again by a positive or a negative. Vision is typically assessed when the patient walks in the door and walks around the examination room. And that I typically would represent with a yes or a no. Retropulsion is whether when I push the eye back into the orbit, whether it's normal or whether it's abnormal. So if you have some resistance to retropulsing the eye, then I would probably write abnormal. However, if it is normal, then I would typically write normal. Aqueous flare again is graded as a 0 to 3, 0 being none, 3 being severe. So you've got hyphema, hypopion, a lot of flare in the ones that are severe, and absolutely nothing in the ones that are a 0. These last two boxes are essentially to denote whether the patient was dilated with a mydriatic agent. So if it was, I would check yes. If we were not, I would check no. So did we add alkane or did we not add, did we add madriacil or did we not add madriacil? Photos taken would be if you've taken images of the patient, and if we're submitting this for a teleconsult, I hope the answer here would be yes. So hopefully that helps understand how we fill out the ophthalmic examination form. If you have any questions, please feel free to reach out to me.